The ReActiv8 system is implanted in your low back during a minimally invasive surgical procedure, typically performed on an outpatient basis. In limited cases, a brief hospital stay may be required. Using a needle, your doctor will guide 2 electrical leads to both sides of your low spine, anchoring them close to the nerves that control the stabilizing muscles in your low back. The leads are connected to a small pulse generator, about the size of a matchbox, which is implanted under the skin in the upper buttock or low back area. As with any surgical procedure, there are risks associated with implanting ReActiv8. Talk to your doctor to make sure you fully understand those risks.